Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, my friends, to our first virtual, recorded, and hopefully very brief class for today. So let's just go ahead and start right away, shall we? Again, today, inshallah, we'll be covering, we're still on Unit 8. We're still on Unit 8, like in this time, we'll be covering pages 64 as well as page 65. So again, pages 64 as well as page 65. We're still discussing the principle of primary care. مبدأ الرعاية الصحية الأولية, a very essential principle in the healthcare system. So we'll go ahead and if you could just go ahead and cross out exercises B, C, D, as well as exercise E. So today we'll only be covering exercises A as well as exercise F. That's it, 2 exercises. So go ahead and cross out B all the way to E. Primary care. So let's just go ahead and answer exercise A, 1, 2, as well as exercise and item 3. Like, before we do that, I'm just going to go ahead and talk about these medical conditions in the blue box, and then at the end we'll answer these 3 questions. Okay, we have 1, 2, 3, 4. We have 6 medical conditions. Okay, we'll try to define these medical conditions and then go back to these 3 questions. The first one on the list, my friends, is what we call diabetes mellitus, or just diabetes, اللي هو داء السكري, and then we'll move ahead to breast cancer all the way to a stroke. First on the list is diabetes mellitus. It is, as you can see here, with both its types. We all know it has 2 types. Okay, diabetes has 2 types, type 1 and type 2. Type 2 being the most common type. And 90% of diabetic people have type 2, okay? As for type 1, only 10%, okay? Only 10% of diabetic people have type 1, type 2 being the most common one. It is a chronic condition, and it's a long-term condition. It never goes away, and there's no cure for this medical condition. So type 1 or type 2. And as we all know, it is basically when the blood sugar levels go up, okay? Next on the list, and there's about 450 million people who have this disease. 450 million people. So it's a very serious disease, okay? And it's pretty common here, especially in Saudi Arabia. Next on the list is breast cancer. Now, don't forget that both men and women suffer from breast cancer. Like in women, in general, have a greater chance of having this medical condition, okay? Both men and women. Breast cancer, as we all know, it's when one of the cells in the breast tissue just substantially and all of a sudden starts growing larger and larger. Sometimes a medical practitioner, they can actually feel the cancer, okay, with their own hands, okay? Third medical condition is heart attack. We all know what a heart attack is. It is basically when the heart muscle, it's the biggest muscle in the human body, the heart muscle does not receive oxygen-rich blood. Yani when one of the veins that deliver blood to the heart, when it's blocked, a heart attack happens. Okay, when this blockage continues for a long time, obviously the consequence is death, la samhallah. Fourth on the list is migraine. Now, migraine is, now we have, my friends, 4 types of headaches. Okay, migraine is one of these types, a very serious type. Okay, it is basically a recurring, yani it happens not only once, like in sometimes several times a month or several times a year, or even several times during your whole life. It is a recurring type of headache. So it's a type of headache, and it ranges from moderate to severe. Okay, the pain affects only one side of the head, and it lasts starting from 4 hours all the way up to 3 days. Okay, again, migraine, recurring type of headache. It ranges not from mild to severe. No, it actually ranges from moderate, okay, in the middle, to severe. Okay, اللي هو الصداع النصفي. We have a few symptoms. Okay, we have a few symptoms for this medical condition, migraine. We have nausea. We've talked about nausea last class. You have weakness. Okay, you could suffer from weaknesses. Okay, while you're suffering or experiencing migraine, you just feel weak. You start feeling sensitive to light and sound. Yani the light is, you'll be too sensitive to light and sound. Okay, it would be very discomforting. Okay, lights and sounds would be very uncomfortable. You might feel dizzy and sometimes visual disturbances. Yani your vision would be a bit blurry and sometimes you can't see very well just because you're experiencing migraine. Causes, we have several causes. One of the most common causes is what we call hereditary. Yani you have a history, a family history with migraine. Because you have a family history or your own history of migraine, you might suffer from migraine consequently. We also have other causes, as these include stress, anxiety, bright flashes, so from your phone or your own computer, loud noises, so always avoid putting on your headphones always. Okay, you can't just be putting on your headphones all of the time. Okay, try to get some rest. Also, too much or not enough sleep. If you get too much sleep or not enough sleep, okay, you might suffer from migraine. Tobacco, smoking cigarettes, and alcohol. Okay, all of these causes. Okay, if you suffer from stress, anxiety, bright flashes, if you smoke too much cigarettes, if you put on your headphones all of the time and the volume is always too loud, you might suffer from migraine. So be very careful, please. Now we're finished with صداع النصفي. Next on the list is stomach ulcer. Stomach ulcer اللي هو قرحة المعدة. It's a sore area on the surface of the stomach. Okay, so it's a sore, inflamed red area on the surface of the stomach, and it's painful, and sometimes you might bleed, or this sore area might bleed and produce poisonous substances. Okay, إذا القرحة سواء the stomach ulcer or any sort of ulcer, it's basically a sore area on the surface of an organ, whatever the organ is. Like in this case, we're talking about the stomach. We're talking about the stomach. So now we're finished with قرحة المعدة. Again, it's a sore area that grows on the outside surface of the stomach, and sometimes it might bleed. Finally, stroke. Now the stroke, now there's a difference between the heart attack and the stroke. The difference is that the heart attack, when the heart muscle doesn't receive blood, the heart muscle doesn't receive blood. The stroke, it's when the brain doesn't receive blood. Then when the vein is transferring blood to the brain, when there is blockage, when the vein is clogged, you might suffer from a stroke. Okay, جلطة دماغية. الهارت attack, سكتة قلبية. There is a difference. Okay, the main difference is that the heart attack, when the blood is blocked from reaching the heart, the stroke is when the blood is blocked from reaching the brain instead. Okay, now let's please go ahead and answer these three questions, question 1, 2, as well as 3. Now, which of these diseases and these medical conditions is best managed in primary care, and which will need to be referred to acute care? I think all of these medical conditions, now all of these are very serious. Okay, so my answer would be all of these are better referred to acute care. There could be a possible exception of diabetes. Sometimes there's a simple solution to deal with high blood sugar, and that is to have an insulin shot. And you can obviously have an insulin shot if you go to the closest primary care center in your own neighborhood. So out of these diseases, I think diabetes can be handled by primary care. Other medical conditions, it's best to be referred to a hospital. It's best for them to be referred to acute care. Okay. Next, question 2, which conditions could primary care help prevent? طبعا حنا we have covered before that primary care, one of the very important roles of primary care is that it works as a preventative medicine. هو نوع من أنواع الطب الوقائي. One of the very important roles, okay, my friends, of primary care is that it works as a preventative medicine. Now, can primary care prevent diabetes? The answer is no. Okay, except for type 2. Type 2, you can prevent and manage diabetes type 2. Okay, like in type 1, there's no way for primary care or حتى acute care to prevent diabetes type 1. Like in type 2, there are a few ways you can follow to avoid being diabetic of type 2. Breast cancer, primary care, okay, cannot prevent breast cancer. Okay, the only thing primary care can do is early detection of breast cancer. And obviously, if you early detect cancer in someone's breast, okay, this way you can minimize the damage. This way you can treat the patient faster and cheaper and more convenient. Okay, ولذلك, okay, when it comes to breast cancer, primary care can do only one thing, and that is early detection. And we'll find later why early detection is very important. Okay, now what about heart attacks, migraines, stomach ulcers, and strokes? I think primary care or حتى acute care cannot prevent these diseases. Okay, it's a bit difficult for any sort of care to prevent these diseases except for diabetes mellitus. Primary care can, in a very few cases, prevent المايجرين اللي هو الصداع النصفي. لكن these attempts cannot be always successful. Okay, question number 3. مثل ما قلنا احنا المايجرين it's hereditary, so sometimes there's nothing you can do about it. Okay, it's hereditary, it's in your history or in your family's history, it's actually in your genes. Okay, and about 10%, okay, up to 12% of the whole world have experienced migraine at least once in their life. Question 3, which conditions are suitable for a follow-up in primary care? Now, what is follow-up? Follow-up is basically having regular medical checkups. A follow-up in medicine is like a checkup. If you have, for example, a surgery, if you have a follow-up, يعني you come later to the hospital or to the primary care center to see how well you're doing. Okay, then a follow-up is to have regular medical checkups to see how well you are doing after a surgery or after a medical condition was detected. Now the question is, which conditions out of these conditions are suitable? It's okay for primary care to follow up on these conditions. The answer is all of them. So if you suffer from a heart attack or a stroke and you go to the hospital, primary care or the primary care center in your own neighborhood المستوصف can follow up on your condition. Yes, at the time of the heart attack or at the time of the stroke or at the time of discovering that you've had breast cancer, you better go to the hospital. You better seek acute care. Like as a follow-up later, as a regular medical checkups in the future, you can go to the primary care center instead of going back to the hospital, because general practitioners can do checkups and monthly follow-ups on your condition. Okay, so the answer for 3 is all of them. They can all, okay, all of these conditions, it's okay, it's suitable for primary care to have a follow-up on the patient who suffer from these conditions as a follow-up. Like at the time of having a heart attack or a stroke or a migraine, maybe sometimes it's better for you to go to the hospital instead. So now we are finished with exercise A, and we have answered all 3 questions orally. Now let's please go ahead and go to exercise F. Exercise F. Now this exercise, we're only going to match the words with the definitions. Okay, like if you could just go ahead and cross out lifestyle, and cross out self-management. We're only going to cover three terminologies. The first one is screening, the second one is profiling, and the third and last one is called false positive. Now, what do these mean? Okay, now we're just going to go ahead and highlight some of the very important sentences on this article. We're going to read very quickly this article, and we're going to highlight a few sentences. So if you could just go ahead, pay attention, and highlight whatever I highlight myself. Okay, my friends? And then at the end, we'll go back to this exercise and answer these three terminologies. The article is called Caring for Our Health, the role, the function, the job of primary care in disease prevention. حنا قلنا one of the very important roles in primary care, one of the very important jobs of primary care is to prevent diseases. Now the big question is how? So let's please go ahead and write, or often go ahead and read the article. Now I've highlighted a few sentences. If you could just go ahead and highlight these sentences on the left column as well as on the right column. So again, what is the role of primary care in disease prevention? Let me just go ahead and start reading up top. Here in the introduction, the article says, or the writer says, at the head of primary care is the concept, يعني a very important concept in primary care is what we call الوقاية خير من العلاج. Okay, in primary care, on every medical practitioner, they have the same exact concept, and this is the concept: disease or disability should be avoided rather than treated. نفس اللي موجود عندنا، الوقاية خير من العلاج، مبدأ جدا مهم في health system. Okay, again, so at the heart of primary care is the concept, a very important concept, مبدأ جدا مهم in primary care, and that is disease or disability should be avoided rather than treated. And obviously, if you avoid the disease, it's way better than treating that disease. Okay, and we have a few economic benefits of avoiding diseases rather than treating these diseases. We have two economic benefits. Okay, the economic benefit of avoiding a disease rather than treating the disease is one, resources for treatments are not required. Obviously, if you avoid the disease, the resources, okay, the tools, the machines, the medications for treatment are not required. Obviously, if you don't have a disease, you obviously wouldn't need the resources or you wouldn't need the treatment. So it's a lot cheaper. Okay, then the economic benefits. فوائد اقتصادية. Okay, نحن نتعلمها من مبدأ وقاية خير من العلاج. One is that resources or treatment is not required, obviously. Two, the individual, or the patient or the person, can continue working and contributing to the economy. طبعا, if you have no disease, obviously the individual, okay, can focus on working and contributing to the economy. And طبعا, please always remember, not all conditions. طبعا احنا قلنا prevention is very important. لكن remember, not all medical conditions can be prevented. Especially two things. One, infectious diseases, for example, COVID-19. Yes, you can prevent yourself from COVID-19, لكن it's not so easy. Sometimes, no matter what you do, okay, you can't prevent contracting COVID-19. Even the president of the United States couldn't prevent himself from that infectious disease. So one of the few cases in which prevention doesn't always work is with infectious diseases. And obviously, okay, here, genetic diseases as well. You then add genetic diseases. For example, Alzheimer's, diabetes type 1. Okay, some diseases are genetic. And obviously, you can't prevent yourself from contracting and having these diseases. مثل ما قلنا, for example, Alzheimer's, or what we call, I forgot what it's called. Let me just go back and check what it is. I just forgot what it's called. Give me a few seconds. Let me just stop the recording. Okay, I'm back. I apologize. I just I just wanted to remember this medical condition, and I just forgot what it is. Like, it's the Down syndrome. It's the Down syndrome. It's another example of a genetic disease that no matter what you do, okay, you cannot prevent it. You cannot prevent it. So let's go back to the article. Then two things you cannot prevent: genetic diseases and infectious diseases. You can, like, it's not so easy. Next, we have a few aspects of prevention. عندنا عدة أشكال من الprevention. Primary care is responsible for disease prevention. How? We have two examples. One, primary prevention is the promotion of health and the prevention of illness, which involves vaccination programs and the efforts to ensure that a safe environment is provided for individuals. يعني one of the very important roles of primary care is the promotion of health and the prevention of illness. For example, a government, sometimes they do ads on TV, they do ads on Twitter, they do ads on newspapers, and all of these ads are promoting health and the prevention of illness. This is one of the very, very important roles of primary care. It's promotions, promoting, okay, how important health is, okay? And they sometimes promote healthy dieting, okay, like running, jogging, eating healthy foods. This is one of the very important jobs of primary care, because it is their job, it is their role, okay, to promote disease prevention. But another aspect of prevention, primary care is responsible for, other than promoting health and prevention of illness, is early identification of disease. And then the question is, how does primary care prevent diseases? Two things. One, promote health and prevention of illness, so on TV, on newspapers, and give vaccinations. Two, early detection. Then one of the very important jobs of primary care is to try to identify an illness, okay, at an early stage. We call it early detection. So let's go ahead and read: early identification of a disease and the provision of prime treatment to minimize the damage. طبعا if you identify a disease early, okay, the damage would be minimized and reduced. This can be done by doing screenings. طيب, how do you prevent diseases? How do you early detect a disease? By doing, okay, something we call, in medicine, we call it screening or medical screening. Now, what's a medical screening? A medical screening is, you can see here the answer, a medical screening is tests that look for a disease before the patient develops any symptoms. Either medical screening is not only one test, like in a few tests that look and try to detect a disease before the patient has any symptoms. طبعا the main objective, the main goal of screening tests or screening or medical screening is early detection of a disease. Then the first very important terminology for today is medical screening, which is medical screenings are, okay, tests, 3 or more, that try to find a disease before you develop any symptoms. طبعا the main objective of that is early detection of a disease. مثل medical screening doctors do for people who think they have breast cancer, okay? طبعا we do medical screenings for a lot of things. Try to find breast cancer, try to find if the man or the woman is suffering from diabetes as well. مثل ما قلنا المedical or primary care can prevent diabetes type 2. If you do screenings, if you try to find any illness before any symptoms, طبعا you might prevent that disease or minimize it if it's already there. Okay, let's go ahead and read this column. Okay, screenings, medical screenings can deliver very considerable benefits. طبعا we have a lot of benefits for screening, and that is early detection and minimizing the effects of a disease. لكن when used with profiling, if you use both screening and profiling as well, the results would be a lot better. Now, what is profiling? You can see here, it's highlighted in black. Then the first terminology here is screening. We all know what screening is. Okay, a number of tests to early detect a disease. Like, what is profiling? The answer is here. Profiling is identifying patients likely to develop specific conditions, whatever the condition is, using data from the patient's record. Yani the doctor, profiling is when the doctor takes a look at your medical history or the history of your family to see if you might develop future conditions based on these records. Yani let's say if the doctor takes a look at the medical records of a woman and he finds out that her mother or someone in her family have had breast cancer in the past. This helps the teacher, or often this helps the medical practitioner or the general doctor to see if this woman is likely to develop the same exact condition in the future and then prevent it. So profiling is very important, and it's as essential as screening. So again, profiling is basically when the doctor takes a look at your medical history or the history of your family to see if you might develop future conditions in the future, or medical conditions in the future based on your history. So if someone in the family has a medical condition of a heart disease, okay, the future often the doctor will work closely with you to avoid that disease in the future. طبعا these are effective. Profiling with screening are obviously very effective and very beneficial. Here the textbook, or often the article, goes again and says early diagnosis. They're just repeating the same idea here. Okay, they're just repeating the same exact idea here, like, and it's highlighted anyway. Early diagnosis, early detection. When conditions or diseases are identified at an early stage, this means diseases are easier to treat and fix and can be completely cured in some cases. طبعا early detection can minimize the disease or the damage of the disease. Sometimes you can completely cure the disease if you early detect it. Okay, نعطي هنا two examples. For example, breast cancer and heart conditions. Some heart conditions, if you early detect that heart condition, you can in the future prevent any heart attacks if you early detect the medical heart condition based on screening and based on profiling. Okay, and both of these terminologies are very important concepts in early diagnosis. The only way you can do early diagnosis is by medical screenings and by profiling. آخر مبدأ عندنا, the last concept, the last terminology is what we call false positive. False positive, في عندنا a lot of false positive tests regarding COVID-19. Now, a false positive is when somebody tells you you have COVID-19, like it turns out that that test is incorrect. So a false positive is results falsely indicating the presence of a disease. Okay, or a medical condition. يعني when a pregnant woman takes a test, or a woman that is not pregnant, and she takes a pregnancy test, and that test indicates that she has a baby, sometimes that test is negative and often that test is incorrect. If the test indicating that she has a baby is incorrect, we call this a false positive. Okay, we call it a false positive. يعني it's not true, you don't have a baby. It's not true, you don't have a certain disease. Okay, مثل ما قلنا مثل COVID-19, we have a lot of false positive in COVID-19 tests. They tell you you have COVID-19, like, and actually there's something wrong with the test, or there's something wrong with the sample. In this case, we call this false positive. هنا عندنا okay, a better definition. في عندنا تعريف أفضل للfalse positive. It is basically tests results incorrectly indicating the presence of a disease. Then a false positive is test results incorrectly indicating the presence of a disease. يعني you don't have a disease. The test tells you you have a disease, like it's wrong, it's incorrect. We call it false positive. You don't actually have a disease. That's why sometimes medical practitioners and doctors, they have more than one test for the same exact condition to make sure that the test is actually negative. Now آخر شيء عندنا اليوم is match these three terminologies with the correct definition. مثل ما قلنا false positive, the answer is it's test results incorrectly indicating the presence of a disease. Now what is screening? Screening is tests for specific conditions carried out on a regular basis. يعني a number of tests carried out on a regular basis every month or every 2 months, okay, to make sure you have a certain medical condition. This is what a screening is. Like my definition is better. I think my definition is better. This is my definition of screening. Screening is tests. طبعا you can stick with the textbook. Like I think my definition is more clear. A screening is, or medical screenings are, tests that look for a disease before the patient has any symptoms. So any test that tries to detect and find a disease before the patient develops any symptoms, we call these medical screenings. So طبعا the main objective of medical screening, along with profiling, is early detection of a disease. Now this is the answer of screenings. And now what do I match profiling with? You match it with identifying patients. Now this is the answer. Profiling is identifying patients likely to develop specific conditions using data from the patient's history records. Then profiling is identifying patients likely to develop, يعني they might develop specific conditions based on their medical records and medical history. Now this is the answer. You can go back to see the rest of the textbook. Now a false positive, مثل ما قلنا, test results incorrectly indicating the presence of a disease. Now we're finished with Unit 8. Next week, inshallah, we'll be covering Unit 9. Thank you guys so much for listening. See you, inshallah, next week. Have a great day. Bye-bye.